Done. Welcome back, guys. Good evening, everyone. Good evening, Chirag, Ansul, Kiran Yadav, Pradyum, Jairam. Good evening, everyone. Hope everyone is having discussion in the chat session. Like everyone is introducing the others. Okay. So now, in last class, what we have discussed about the cardiac cycle. We have seen what are the different phases in the cardiac cycle. We have seen what are the phases in the systole, what are the phases in the diastole. We have seen everything, right? Now, in this class, based on that concept, what we have discussed, the cardiac cycle, based on the concept of cardiac cycle, I will be discussing about something called as left ventricular pressure volume loops. Left ventricular pressure volume loops. Okay. So LV pressure volume loops. So what exactly is LV pressure volume loops? The left ventricular pressure volume loops. What exactly are they? Many students find it very hard to understand this concept, left ventricular pressure volume loops. But in reality, it's very easy. It's a damn easy. Okay. Let me make it as simple as possible for you. Those students who have understood the cardiac cycle, for them it is very easy. Those students who have already have an idea about the cardiac cycle, for them it's very easy topic, sir, very easy topic. But if without having a proper knowledge on the cardiac cycle, if you want to understand the left ventricular pressure volume loops, it will be a nightmare. Okay, it will be tough for you to understand. Okay, so but anyway, I will try to make it as simple as possible. So just some recap questions. Okay, let's have a little recap. So can you tell me what is EDV? EDV, end diastolic volume. Can you tell me what exactly is end diastolic volume? End diastolic volume is also called as preload. Can you tell me what exactly is this end diastolic volume? Yes, Ansul Sharma, you are true. 120 to 140 ml. That's the blood. The amount of blood that's going to be present in the ventricles. The amount of blood that's going to be there in the ventricles. Okay, how much ventricular filling is going to happen? 120 to 140 ml of blood. इसको क्या बोलते हैं? Preload. We will call it as preload. Okay. Now, done, sir. Now, can you guys tell me what is end systolic volume? End systolic volume, sir. After the systole, you have kept 120. You have kept 120. Now, when the heart beats, when the ventricle beats, okay, when the ventricle beats, out of that 120, 70 is going to come out. 70 is going to come out. That is the stroke volume. That 70 that's coming out into the aorta, that's called as the stroke volume. Then how much is left over, sir? How much is left over? The leftover is the end systolic volume. So that is 50 ml. Okay. So 50 ml is left over. That's the end systolic volume. And how much is the stroke volume? You know it. Stroke volume is 70 ml. 70 ml. Okay. Now, you know the formula, based on this, you can put the, you can came to the formula for the cardiac output. Cardiac output. So what is the cardiac output? Cardiac output is stroke volume into heart rate. How much is our stroke volume? 70 ml. How much is our heart rate? How many times our heart will beat? Okay. A human heart is going to beat somewhere around 72 beats per minute. Okay, it's just a round figure value, sir. Okay, so 70 into 72 is somewhere around 5 liters, approximately 5 liters. Okay, approximately 5 liters, that's our cardiac output. So what is the formula for the cardiac output? The formula for the cardiac output is stroke volume into stroke volume times heart rate, right? Next, so please look here. End diastolic volume is 120 to 140. End systolic volume is 50. Means ventricle is going to fill from 50 ml. Starting it is 50 ml. So starting it's going to be 50 ml. 50 ml is there. Now from 50 ml, it will fill up till 120. 120. So now look here. I'm going to plot a graph now. Okay, I'm going to make a graph. So on x-axis, I'm going to talk about the volumes. Okay, on x-axis, what I'm talking about? I'm talking about the volume. Volume. Which volumes? In the heart, you know, there is something called as end-diastolic volume, end-systolic volume, stroke volume. On x-axis, I am going to discuss about the volumes. On y-axis, dekho. Here, this is the y-axis. On y-axis, what I am going to discuss about? I am going to discuss about the pressures. Okay, which pressures? Left ventricle ka pressures, you know it. Left ventricular pressure increases from 5 to 80, 80 to 120, 120 to back to 80. You know it. So, you know some pressure changes also inside the ventricles. Okay, in the last class, in the cardiac cycle topic I have explained you. Okay, so now look here, on y-axis I am going to talk about the pressures. Okay, which pressures? Left ventricle ka pressures, LV pressures, sir. Left ventricular pressures. Okay, that is LV pressures. Okay, guys, let's put it as simple as possible. Now tell me, now ventricle is not contracting, sir. How much blood is there in the ventricles? First, initially 50 ml will be there. Okay, 50 ml will be there. So here, right, this is 50 ml. Now this much amount of blood is there, 50 ml blood is there. Ventricle is like this. And how much is the ventricular pressure? Usually ventricular pressure is somewhere around 5 mm Hg. Left ventricle, sir. Right now I am talking everything about the left ventricle only. I am not talking about atria, I am not talking about the right ventricle. Only I am talking about the left ventricle. Okay? So what is the pressure in the left ventricle? Somewhere around, sir, 5 mm Hg. 5 mm Hg. Left ventricle ka pressure. 50 ml blood is there. That's the point. Okay, that's the point. Now what happens? Sir, ventricle will fill with blood, right? Ventricle will fill with blood. How it will fill with blood? Due to two processes. Rapid ventricular filling. 70% of the ventricle is going to fill with the blood. And atrial contraction. Atrial contraction contributes to 30% filling of the ventricles. So because of this rapid ventricular filling as well as the atrial contraction, ventricle will start to fill. Okay, so ventricular volume from 50, it will go to, from 50, because of this filling, dekho, ventricular volume, sir, it is increasing up till 120. So this is 120 ml, 120 to 140 ml. So till here, sir. Okay. So now in this left ventricular pressure volume loop, whatever I am going to draw, so this blue color line that I have drawn here, so this blue color line, it represents what? So this blue color line, it represents left ventricular filling. That left ventricular filling occurs due to what? So the left ventricular filling occurs because of rapid ventricular filling as well as the atrial contraction. Because of the rapid ventricular filling, 70% of the filling, 70% filling of the ventricle will occur. Cardiac cycle topic explained. And atrial contraction will lead to 30% filling of the ventricle. So ventricles filled. 120 is there now. 120 is there. Now, guys, use your brain and answer me. When you have 120 ml of blood in your ventricle, now ventricle will contract or not? Yes, sir. Ventricle will start to contract. Now ventricle is contracting. When the ventricle started to contract, tell me immediately what happens. Which valves will close? Now the left ventricle is starting to contract. Okay, in the left ventricle, pressure is bahut kam hai, just only 5 mm Hg. The pressure is just 5 mm Hg. Now, with this 120 ml of blood, left ventricle started to contract. Now, tell me what happened to the valves. Which valves? What happened to those valves? Can anyone tell me? Sir, the AV valves, excellent, Atvik, I think. What happens to the AV valves? Especially the mitral valve. The mitral valve closes. Immediately, the mitral valve closes. So that's why exactly here at this point mitral valve closes. Okay, as I am talking only about the left ventricle, I am talking about only mitral valve. I am not saying just AV valve, because AV valve include tricuspid valves also. Okay, so it's the mitral valve closes. Okay, mitral valve closes. Now tell me, after the mitral valve closes, nothing is coming into the ventricle, nothing is going out of the ventricle. Okay, so there is no more further filling. That's why there is no further filling happening, no further increase in the volume. Now what is happening? Ventricle is contracting, nothing is coming in, nothing is going out. So what happened to the ventricular pressure? Ventricle is contracting, sir. So what happened to the ventricular pressure? Ventricular pressure increases during heartbeat, or when the ventricle is contracting, the pressure in the left ventricle goes up. So that's why, look here. Now let me take some other color. Now dekho, the left ventricular pressure increases. Okay, left ventricular pressure increases. Dekho. Left ventricular pressure is increasing. Now, tell me, what is this black color line representing? What is this black color line representing? It is representing which phases of the cardiac cycle. What is this black color line representing? It represents which phases of the cardiac cycle? I will give you options. Atrial systole, isovolumetric contraction, rapid ejection phase, slow ejection phase, protodiastole. Now answer. It is representing Kiran Reddy, Advik, Alphaz, Rama. Come on guys, it's representing which phase of the cardiac cycle? What do you think? Come on. Let me see who can answer. Varun Kashyap, excellent. It represents what? IVC, isovolumetric contraction. Yes, Karan Yadav. Yes, Ruchi Patel. Yes, it represents isovolumetric contraction because nothing is going out, nothing is coming in, nothing is going out. Simply the ventricle is contracting. So when the ventricle is contracting, the pressure from 5, it goes to 80. It goes to 80. Now when the ventricular pressure, when it becomes 81, when the ventricular pressure, when it becomes 81, like this, 80 to 81. Now imagine, now here the pressure is 80. Now here it is 80 mmHg. Now when the ventricular pressure becomes 81, sir. Now what happens immediately at this place, at this point, which valve opens? Now tell me, which valve opens at that area? Because now the ventricular pressure is 81 or 80.1, I should say. Now, yes, excellent Varun Kashyap. It's a AV valve, sorry, not AV valves, it's a aortic valve. Excellent, excellent. Okay, aortic valve. Aortic valve, Harsh, you are also true. Opens. Okay, aortic valve opens. Okay, Pyrie David, Elfie James, Ansul Sharma. Yes, all of you are true. Okay, it's the aortic valve opens. Now tell me, when aortic valve is open, what happens, sir? Immediately what happens? Sir, when aortic valve is opened, from the left ventricle, see, from the left ventricle, blood is going to enter into the aorta. Blood will enter into the aorta, sir. Right? So what happened to the left ventricular volumes? Left ventricular volume, the amount of blood in the left ventricle decreases, right? So now what is this phase? So actually two things will happen now. Two things will happen. So still left ventricle is contracting, Pressures from 80 will increase to 120. Ventricle is contracting, pressure from 80 it will go to 120 due to the apex of the heart contracting, right? And not only that, so there is volume change also happening in the ventricle. The volume, the amount of blood in the ventricle is going down because blood is ejecting into the aorta. So that's why, see what is happening now. Let me show you with the green color now. See? Like this. From here to here. Now tell me what is this phase. Now here the pressure is, for example, 120. Now tell me, what is this green color line that I have drawn? What is this green color line that I have drawn? What is this phase of the cardiac cycle? Sir, in this phase of the cardiac cycle, the pressure is increasing. That's why from 81, that's why the pressure from 81 increases to 120. Not only that, deco guys, it's a volume also coming down. The volume, see, when you look at the volume is coming down in the ventricle, which means the blood is ejecting into the aorta. So volume is also coming down. Okay, so now tell me what is this phase? Varun Kashyap, excellent, excellent. So this phase which I have shown here is called as the rapid ejection phase. Rapid ejection phase. After rapid ejection phase, what is the next phase? So after rapid ejection phase, the 2/3 of the stroke volume. Okay, 2/3 of the stroke volume is going to be ejected. Okay, let me write here 2/3 of the stroke volume is ejected, sir. Now after this, what is SEP? Rep completed. Next SEP. So from here, the pressure will again come down to 80. So this is 1/3. 1/3 of the stroke volume is going to be ejected. Now see, the pressure from 120 is coming back to 80. So this phase is called as, yes, excellent Varun Kashyap, this is called as slow ejection. Okay. स्लो इजेक्शन सर. So rapid ejection हो गया, slow ejection भी हो गया. Okay, rapid ejection, slow ejection. 2/3 of the stroke volume, 1/3 of the stroke volume. Now tell me, slow ejection also completed sir. The pressure in the ventricle is now 80. Okay, the pressure in the ventricle is now 80. Now tell me, what happens? The contraction completed, isovolumetric contraction, rapid ejection phase, slow ejection phase completed. So systole completed. Systole completed. Now after the systole, tell me what is next phase? Diastole. In the diastole, what is the first phase? Protodiastole. So during protodiastole, what happens, sir? So the pressure from 80 will come down to 79. The pressure from 80 will come down to 79. So now imagine, the pressure is here 79, sir. From 80, the pressure got little down, 79. From 80, it got little down, sir, 79. Now ventricle started to relaxing. So tell me, which valve closes here? Aortic valve, sir. Aortic valve closes. Aortic valve closes. Because the pressure in the left ventricle decreases, aortic valve closes. Now, once the aortic valve is closed, now what is happening? The aortic valve is closed. Already mitral valves already closed here. They are all long back closed. Mitral valves are closed in state. Now here aortic valves are also closed. Okay. Now tell me, what is happening to the left ventricle? Left ventricle is simply relaxing. Nothing is coming in, nothing is going out. Ventricle is relaxing, sir. So ventricular pressures from 80 is coming down to 70, 60, 50, 40, 10, something like this. So the ventricular pressures are decreasing. Okay, ventricular pressures are decreasing, sir. Okay, let me take some color. Now see, the ventricular pressures are decreasing. The pressure from 80, it is coming down. So ventricular pressure become 40, 50, 40, 30, 20, 10, 5. See, now when the ventricular pressure becomes less than 5, now tell me. So now the ventricular pressure is becoming less than 5. What happens? When the ventricular pressure is now becoming lesser than the atrial pressure, when the ventricular pressure is becoming lesser than the atrial pressure, which valve opens? The mitral valve opens. So here, mitral valve opens. Yes, Varun Kashyap. Mitral valve opens. Okay, mitral valve opens, sir. So on right side, mitral valve opens. Left side, mitral valve closes. On the top they go, but here, what is happening? On the top we are discussing about the aortic valves. Okay, we are talking about the aortic valves. On right side, okay, for example, imagine this is right side of the graph, this is the left side of the graph. Okay, on one side I am talking about the aortic valve. Here what happens? Aortic valve closes. I should write properly. Closes. Yeah. On one side aortic valve is closing, other side aortic valve is opening. On one side mitral valve is opening, other side mitral valve is closing. So now what is this phase? What is this phase, sir? That brown color line that I have shown here. This is called as isovolumetric relaxation. Isovolumetric relaxation. So this is the NEET PG questions and FMG questions which are asked many times. This phase, the blue color phase, is representing left ventricular filling. The black color phase here, the black color line which I have drawn here, it is representing isovolumetric contraction. This line which I have highlighted just now, it's representing the rapid ejection phase, and this line which I have shown right now, it indicates the slow ejection phase followed by isovolumetric relaxation. Now it's totally forming a loop, right? Now it's totally forming a loop. So what is this loop, sir? Now here we are discussing about the left ventricle ka pressures and left ventricular ka volumes. Okay, left ventricle ka volumes. So now this is called as left ventricular pressure volume loop, LV pressure volume loop. So left ventricular pressure volume loops, as simple as that. Okay, now you understood, right? Left ventricular pressure volume loop. Now I will ask you some questions, you just tell me. Sir, what is this that I am pointing here? For example, imagine this X. X represents what? And here I am representing Y. Y represents what? X and Y represents. X, there is a value 50. Y, there is a value 120. X and Y represents what? Sir, X represents, you should tell me. Y represents, let me see who can answer. What is X, sir? Ansel, what is X? Ansul, Harsh, Kashyap. So what exactly is X representing? Raj Patil. No. Varun Kashyap, you are true. Excellent. See, it's the end systolic volume. End systolic volume. That X is 50. That X is 50. 50 ml. What is 50 ml? How much is going to be there in the ventricle? Always in the beginning, sir. 50 ml is 50 ml is going to be there. So it's the end systolic volume. Then what is Y representing? What is Y representing? End diastolic volume. End diastolic volume. Okay. So now the difference between these two. What is this difference? Now here what they have mentioned, like, what is this difference, sir? The difference sir, difference between X and Y. What is the difference between the X and Y? Can you tell me? Sir, Y is how much? 120. So 120, say, minus the 50. Okay, minus the 50. So difference 120, 50. What is the difference, sir? 70. So what is the 70? 70 is the stroke volume. 70 is the stroke volume. So here it is the stroke volume, sir. Okay, stroke volume. So this is all about the left ventricular pressure volume loop. Done. Okay, very important for the exams from the physiology. Now, let me explain you with some examples. Okay, sir, in your second year, okay, when you come to your second year, there you will study about the pathologies, left ventricular pathologies like mitral stenosis, mitral regurgitation, aortic stenosis, aortic regurgitation, something like that. Now, let me draw here an example. There is a condition called as aortic stenosis. Aortic stenosis. Sir, what exactly is aortic stenosis? Here, aortic, it represents aortic wall. Aortic wall. Okay, aortic wall. The stenosis represents to the stiffening. Stiffening due to calcium deposition. Guys, remember with age, okay, with age, what happens is, or not only just with the age, in certain pathological conditions, so this is the left ventricle, look, okay, in certain pathological conditions what happens is, so this is the aortic wall, right? This is the aortic wall. Now this aortic wall, it will undergo calcification, totally calcium will come and deposit over there, okay, calcium will come and deposit over here. So now tell me, these walls got hardened. The hardening of the walls or the stiffening of the walls. The stiffening of these walls is called as AS, aortic stenosis. Okay, aortic stenosis. Okay, so what happens if there is an aortic stenosis? What happens if there is an aortic stenosis, sir? Now, what kind of changes seen in left ventricular pressure volume loops? Left ventricular pressure volume loops mein what kind of difference you can see? Okay, now you just tell me, logically tell me, sir. Sir, whenever there is such a stenosed wall, stenosed aortic wall, now it's very hardened wall, no? So now to open such a stenotic wall, left ventricle have to do more job or left ventricle have to do less job? Left ventricle have to do more job. Simple, left ventricle have to do more job. For example, say, normally, so this is your left ventricle, this is your aorta, now this is your aortic wall. Now imagine the aortic valve is closed state, it's in the closed state, sir. Here the pressure is 80 in the aorta, 80 mmHg. Now to open this aortic valve, to open that valve, left ventricle have to generate how much pressure? Left ventricle have to generate a pressure of 81. Okay, simple as that. Now if here the pressure is, for example, 120, left ventricle have to generate 121, you know it. But now in this condition, sir, here the pressure is okay, normal, 80 only. But left ventricle, if it generates 81 mmHg pressure, that valve is not going to open because that valve is calcified. Pathologically, it got calcified. So now, what happened to the afterload? In last class, I have explained you what is afterload. The afterload is the amount of pressure generated by the left ventricle in order to open the aortic valve. Now, after load increases. Now left ventricle have to just, now 81 is not enough, sir. Now 81 is not enough. Now the left ventricle may have to generate 150. Okay, 150 more pressure. Okay, so if I draw left ventricular pressure volume loop, this is normal left ventricular pressure volume loop. Dekho, guys, very important. Imagine this is ventricular filling, isovolumetric contraction, rapid ejection phase, slow ejection phase, isovolumetric relaxation. This is normal, sir. Normal. Now what kind of, this is normal. First, this black color thing is normal. What kind of change will be seen in a patient who is having aortic stenosis? I am the one who is having aortic stenosis. What kind of left ventricular pressure volume loop is going to be changed? It's going to look like this. It's going to look like this, sir. Dekho. This is how the left ventricular pressure volume loop is going to be. So the left ventricular pressure volume loop in a patient who is having aortic stenosis is going to change like this. What you have appreciated here, normal person can develop a pressure up till 120. Okay, normal ventricle will develop a pressure up till 120, sir, 120. But in this condition, the patient who is suffering with aortic stenosis, he will generate more pressure. In order to open the aortic wall, he have to generate the more pressures. So that's why pressure wise it is increased. Now he is generating almost maybe 150 pressure, 150 mm Hg pressure. Okay, simple. Now what happened? The left ventricular pressure volume loop, it became tall. Now it became tall, sir. So pressure is increasing. The left ventricle have to generate more pressure in order to open the aortic wall. So more pressures are seen. And not only that. See, dekho, we have seen normally. Let me put this normal thing. This is the stroke volume, right? The difference between these two lines. End systolic volume is 50. And this is the end diastolic volume. End diastolic volume is 120. The difference between them is the difference between these 2 points, from this point to this point. What is the difference? The difference is called as the stroke volume. Now, in a patient who is having aortic stenosis, look here. So, this patient is having aortic stenosis. Now, these walls are calcified, no? These walls are calcified. So, do you think those walls are going to properly open? Even if they open, do you think properly they are going to open? No. There is going to be a narrow orifice. The orifice is going to be very much narrow. Okay. Let me show you here the orifice. The orifice is going to be narrow orifice, small orifice. As the orifice is narrow, do you think all the blood, all the stroke volume will enter into the aorta? No. Less blood will go out. Less blood will go out. As less blood is going out into the aorta, what happened to the stroke volume? Stroke volume decreases. So that's why in this patient with aortic stenosis, the stroke volume is less. Okay, stroke volume is less. That's why the difference is coming less. So yes, they are filling 120, no doubt. But what happened to their end diastolic volume? Normal person end diastolic volume, sorry, what should happen to their end systolic volume? Normal person's end systolic volume is 50 ml, 50 ml. But in this condition, aortic stenosis, they go, the patient's end systolic volume. Okay, this is end systolic volume. In aortic stenosis, end systolic volume, how much it is? Instead of 50, now maybe it is 80. So end systolic volume is increasing. End systolic volume is increasing, which means blood is not going into the aorta properly. The leftover blood is more. Normally it should be 50. Okay, if 70 ml goes out of the heart, 50, sir, leftover is 50. But blood is not going out now. As the blood is not going out now, more leftover. Leftover blood is more. So end systolic volume instead of 50, now it became 80. It became 80. Okay, so simple, sir. So in a patient who is having aortic stenosis, so this is how the left ventricular pressure volume loop is going to change. So the graph is going to be tall with less stroke volume and more end diastolic volume. Okay, so why I have given you this example is usually in your first year, no one will ask you about this aortic stenosis. But understanding, this is the normal. How it's going to be changed in pathological conditions like aortic stenosis. How it's going to change in pathological conditions like aortic stenosis, sir. Understood? So, left ventricular pressure volume loop topic is completed. Now, this is the normal left ventricular pressure volume loop. Okay, when you come into your first year in your university, you will get these PDFs and everything. Okay, so the pink color is representing the ventricular filling. The light blue color is representing the isovolumetric contraction. The green color is representing rapid ejection and slow ejection phases. You have seen this, and that yellow color is representing the isovolumetric relaxation. Okay, isovolumetric relaxation. All these events here I have given in the blue color thing. Okay, in the explanation, like an explanation. You can theory, you can go through that later also. So they go in aortic stenosis. Aortic stenosis, see, this is normal. For example, consider this as normal. In a patient with aortic stenosis, see how the left ventricular pressure volume loop is changing. It is becoming a tall. Okay, in other disorders like aortic regurgitation, how it changes, mitral stenosis, mitral regurgitation, how it changes, that you can study later in your pathology. And once you complete your first year, in second year you can study them. Okay, for understanding, I have explained you one thing. Next, after this, the next topic that I am going to discuss today is jugular venous pressures. Okay, jugular venous pressure changes. What exactly are these jugular venous pressure changes? Simple, sir. Okay, so jugular venous pressure changes. Many students doesn't properly understand what exactly are these jugular venous pressure changes. They don't have a proper idea, sir. Very frankly speaking, even by the time they are graduating, okay, for 5th year MBBS, they don't properly know what are these jugular venous pressure changes. So now itself, no. Okay, the actual concept. First, let me tell you what is the actual concept. Okay, see, dekho sir, this is your heart. Imagine this is your heart. Now, what is this? This is the right atria, sir. Right atria, right ventricle, left atria, left ventricle. What is this blood vessel? Aorta. Here on this side, what will be there? So there will be pulmonary trunk. Pulmonary trunk will be there. Now, look, in your anatomy you will study. The right atria, it receives deoxygenated blood, sir. Right atria receives deoxygenated blood. From where? From the inferior vena cava and superior vena cava. Okay, superior vena cava. Sir, inferior vena cava brings, see, from your lower parts of the body, all the deoxygenated blood will be brought by the inferior vena cava. From the head and neck, the deoxygenated blood, the venous blood, is going to be brought by the superior vena cava. Okay. Now, in your neck, there is a vein called as internal jugular vein. There is a vein which is present in your neck, which is called as the internal jugular vein. Now, this internal jugular vein, in this internal jugular vein, you can see pressure changes, sir. Sometimes pressure increases, sometimes pressure decreases. So, in the internal jugular vein, sometimes pressure increases, sometimes pressure decreases, decreases. Why they are increasing and decreasing? So, that's what we are going to discuss in jugular venous pressure. Jugular vein mein pressure changes. Okay, jugular vein mein pressure changes, sir. Now, why? Look, for easy understanding purpose, not anatomically correct, for easy understanding purpose. Now, imagine this is superior vena cava. Sir, superior vena cava, it is in connection with the internal jugular vein. Now, for understanding purpose, now let's think that this is internal jugular vein. Internal jugular vein. Internal jugular vein mein who is there? Venous blood, sir. Venous blood, all this is the deoxygenated blood or venous blood. Okay. Now, tell me, sir, for example, it's like a one column, right? It's all like a one chamber. Okay. Sir, here right atrium is in connection with the superior vena cava. Superior vena cava, it is in communication with the internal jugular vein. Internal jugular vein. Now, blood is coming like this. Because of some reason, or not why just because of some reason. Simple. Atrial contraction. Now, the right atrium is contracting. Okay, right atrium, I am now going on to only talk about. Now, I am going to talk only about the right atrium, sir. I am not concerned about the left atrium, right ventricle and left ventricle. I am not concerned. I'm only going to be concerned about the right atrium. Right atrium. Now, right atrium, it is contracting. When the right atrium is contracting, now what happened to the blood flow into the atria? Now, atrium is contracting, sir. Atrium is contracting. When the atrium is contracting, do you think it will receive the blood now? Do you think it will fill with the blood now? No, atria is emptying the blood into the ventricle. So, at that time, do you think atria will receive the blood from the internal jugular veins and superior vena cava? No. No. So, what happened to the blood here? Blood is going to stay here itself. Okay, the blood here, it's going to stay here itself. And what happened to the internal jugular venous pressure? Internal jugular venous pressure increases. Now, right atrium is not receiving the blood. So, blood is just getting stagnated over there. So, right, or I should say, the internal jugular vein pressure increases. This is one way of understanding. That's actually the conceptual way. Concept is, when right atria is receiving the blood, it's continuously receiving the blood, internal jugular vein pressure also decreases. When right atrium, when it is not receiving the blood, internal jugular vein pressure increases. That's the actual concept, But for easy understanding purpose, I used to remember something like this. Sir, right atrium, superior vena cava, superior vena cava, internal jugular vein, they are just like one chamber. They are like one chamber. If here pressure increases means, here pressure increases, internal jugular vein may also pressure increases. You can see it. The internal jugular vein is going to be distended, sir. When pressure increases, internal jugular vein is going to distend. I will show you the image also. Okay. So, tell me, whenever the pressure in the right atrium increases, superior vena cava may pressure increases and internal jugular vein may pressure increases. Simple as that. Now, look here. So, these are the jugular venous pressure changes. Okay, these are the jugular venous pressure changes. See, sometimes the pressure in the internal jugular vein is increasing. That's the A wave, and the pressure is again decreasing. That is the X wave. A wave is increasing, the pressure increasing. X wave, pressure is decreasing. And there is a small C wave is there. I will explain you about that. Sir, what is this V wave? V wave means again the pressure in the internal jugular vein is increasing and again decreasing. So, pressure increases, decreases. So, it's the representation. This jugular venous pressure changes is nothing but the representation, graphical representation of the pressure changes in an internal jugular vein. Okay. So, you are graphically representing the pressure changes. Sometimes pressure increases, decreases. When it will increase, when it will decrease, now I will explain you. Okay. So, look here, sir, how many waves are there? First of all, in jugular venous pressure changes, there are A, C, X, V, Y, A, C, X, V, Y waves. Okay, A, C, X, V, Y, 5 waves are there, A, C, X, V, Y. Sir, in which are the positive waves? Positive waves means the pressure is increasing. So, the positive waves are A, C, V. A, C, V are the positive waves, X and Y waves. Okay, X means all, let's consider all this as one, sir. Okay, this all is the X. Okay, X and Y. X and Y waves are negative waves. X and Y are negative waves. A, C, V are positive waves. Now, in which conditions? Again, in which conditions the pressure in the internal jugular vein increases? First, one by one. Sir, A wave is because of atrial contraction. A wave is because of atrial contraction. Now, I have explained to you already. When the atria is contracting, think like this, sir. Easy understanding. When the atria is contracting, what happened to the atrial pressure? Atrial pressure increases, sir. When the atrial pressure increases, superior vena cava, internal jugular vein. Internal jugular vein may also pressure increases. Simple. So, that's why there is increased pressure in the internal jugular vein. Okay, there is increased pressure in the internal jugular vein. Okay, simple. Now, after atrial contraction, what will happen? Atrial relaxation. Atria is relaxing. When the atria is relaxing, what happened to the pressure in the atria? Decreases. Atria is receiving the blood. So, atrial pressure decreases. Superior vena cava, internal jugular vein also pressure decreases. Why? Because now blood is easily flowing down into the atria. Okay. So, X waves and all this X wave. Okay. So, it represents what? Atrial relaxation. Okay. Atrial contraction as well as atrial relaxation. Okay, in your first year, what you should know is simple basics. Not in just in first year, any first year to fifth year, the basic thing. A wave represents atrial contraction. Okay, when the atria is contracting, the pressure in the internal jugular vein is also gradually increasing. When the atria is relaxing, the pressure in the internal jugular vein also gradually decreasing. A wave, X wave. Sir, X wave bhi ho gaya. So then what is the C wave? Sir, this one special wave is coming. What is the C wave, sir? Okay, C wave. See, now you need to understand. When the atria is relaxing, okay, while the atria is relaxing, now what happens is, now you look here. Now let's try to understand like this. Now imagine this is the internal jugular vein. Directly I am showing the internal jugular vein, sir. I am even taking out the superior vena cava. Okay. Now this is right atria, right ventricle. Now ventricle is contracting. Okay, ventricle is contracting, sir. Ventricle is now contracting. Now when ventricle contracts, so here the tricuspid valve will be there, no? This tricuspid valve will actually bulge. It actually bulges into the right atria. Okay, it actually bulges into right atria. Now this bulging of right atria increases the right atrial pressure little bit. Increases the right atrial pressure little bit, sir. So internal jugular vein may also little bit pressure increases. So the C wave, okay, C wave, it's because of bulging of the tricuspid valve into right atria. Bulging of the tricuspid valve into right atria with ventricular contraction. So ventricle is contracting. Okay, ventricle is contracting. Okay, ventricle is contracting. When the ventricle is contracting, the tricuspid valve goes. Okay, tricuspid valve it goes. Where it will goes? It will goes into the right atria. When it is going into right atria, okay, when it goes into the right atria, right atrial pressure little increases. Internal jugular vein may also pressure little increases. So mainly here what you need to know is, sir, this wave, this A wave is seen during atrial contraction. Next, X wave, this X wave is seen during atrial relaxation. X wave is seen during atrial relaxation. After the atria is relaxed, ventricle started to contract. Okay, ventricle started to contract. When ventricle is contracting, when ventricle is contracting, tricuspid valve bulges. Tricuspid valve bulges into the right atria. So right atrial pressure increases. Internal jugular vein may also pressure increases. So that's why. Now ventricle contracted and ventricle will relax, right? So ventricle is also relaxing. When ventricle relaxes, tricuspid valve, it will come down. Right atrial pressure decreases. Internal jugular vein pressure decreases. Again I am repeating. Ventricle is relaxing. Ventricle is absolutely relaxing. When ventricle is relaxing, the tricuspid valve which have gone up, it will come down. The tricuspid valve is going to come back to its original place, so that right atrial pressure decreases, internal jugular vein pressure also decreases. That's what this X dash. So what exactly is this X dash representing here is देखो. So the downward movement of the tricuspid valve again back. So right atrial pressure decreases, internal jugular vein may also pressure decreases. But no one will ask you about the X dash specifically. Simply what they will ask you is, A wave is seen during atrial contraction, X wave during atrial relaxation, C wave during ventricular contraction. During ventricular contraction, tricuspid valve bulges into the right atria, right atrial pressure increases, internal jugular vein pressure also little increases. Okay, done. Now sir, atria contracted, atria relaxed. Now after the atrial relaxation, now atria is in relaxed state. Atria is absolutely relaxed. When the atria is relaxed, tell me, it will start to receive the venous blood. It will start to receive the venous blood from superior vena cava, inferior vena cava. So more and more blood it is receiving, right? So when it is receiving the blood, okay, when it is receiving the blood, what happened to the pressure inside the right atria? The pressure in the right atria increases. Okay, the blood is filling, sir, blood is filling. So the amount of new blood that can come down into the right atria decreases. Let's put this in a simple way. Atria is completely relaxed. Now it is receiving the venous blood. When it is receiving the venous blood, the right atrial pressures gradually increases. Internal jugular vein may also pressure increases. So this V wave, what it is representing? So the V wave represents venous filling. Okay, so the atria is filling with the venous blood. The atria is filling with the venous blood. So atrial pressure more, internal jugular venous pressure also more. You can understand it like that. But the real concept is the when atria is filling with the blood, it's filling, sir, gradually it is filling. So what happened to the further filling? Further filling decreases. It can only take certain amount of blood. It can only take certain amount of blood. So atria is filling. So can the blood from the internal jugular veins, can it go down now into the heart? No. So gradually, that's why the pressure in the internal jugular vein increases. The pressure in the internal jugular vein increases gradually. Why? Because atria are filled. It cannot take the further blood. So the jugular venous blood is also not going down. So jugular vein mein pressure is increasing. So V wave represents what? So V wave represents atrial filling. Okay, V for venous filling of the atria, the venous filling of the atria. Completed, sir. After V wave, the next wave is Y wave. Okay, after V wave, the next wave is Y wave, sir. What exactly is Y wave? Look here. So the pressure is decreasing. The pressure in the internal jugular vein is decreasing. Why? Because now atrial emptying. Okay, sir, now atria are filled with the blood. Now when the atria are filled with the blood, what happens? Tricuspid wall, it opens. Okay, look, let me put it this way. Sir, this is right atria. Now it have filled with the blood. Completely filled with the venous blood. Now when it is completely filled with the blood, which wall opens, sir? Tricuspid wall opens. Now when the tricuspid wall opens, all the blood, 70% of the blood, it will fall down. It will fall. Where it will fall? Into the right ventricle. So what happened to the pressure here? Decreases. What happened to the internal jugular venous pressure? Internal jugular vein pressure also decreases. IGV pressure also decreases. So Y wave, so dekho, why the pressure in the internal jugular vein is coming down? Simple. The right atria is emptying the blood into the right ventricle. So it can receive the blood now. It can receive the blood. Okay, it can receive the blood from the internal jugular vein. So in the internal jugular vein, pressure decreases because the blood is flowing down into the right atria again. Okay, so pressure is coming down. So simple. So these are the pressure changes in the internal jugular vein. The pressure changes in the internal jugular vein during cardiac cycle. Okay, during cardiac cycle, in the internal jugular vein, pressure increases and decreases. How many times pressure increases? 3 times. A, C, V. A wave, C wave, V wave are the positive waves. X wave and Y wave are the negative waves. A wave is because of the atrial contraction, X wave is because of the atrial relaxation, C wave is because of the ventricular contraction, V wave is because of the venous filling of the atria, and Y wave is because of emptying. I used to remember like V for venous filling. Okay, V for venous filling. And what is Y for? Y for emptying, EMPTY. Okay, emptying. So, done. So these are the normal jugular venous pressure changes. Now, if you understand this, I will tell you certain abnormalities. Okay, how the questions will be asked in your exam. Okay, how the questions will be asked in your exam. Now, the examiner can say absence of A waves in jugular venous pressure tracing. In jugular venous pressure tracing, A waves are absent. Absent A waves. The A waves are absent. Okay, A waves are absent. In which condition it is seen? A waves are absent. It is seen in which condition? Why A waves are absent? Or in which condition A waves are absent? Now, in order to understand this, you should know. So, the A waves, first of all, in the first place, the A waves are because of what? A waves are because of atrial contraction. You know, A wave is because of, see this, dekho, here. A wave is because of atrial contraction. Now, right? A wave is because of atrial contraction. Okay, A wave is because of atrial contraction. Okay. If A wave is because of atrial contraction, then absent A waves are seen in. Absent A waves are seen in. See, if there is no atrial contraction, which means atrial asystole. Okay, atrial asystole, sir. There is atrial asystole, means atria is not contracting. In the condition of atrial asystole, the A waves are going to be absent. Okay. Now, can you give me examples of atrial asystole? In which conditions atria will not contract? In which condition, sir? Varun Kashyap, in which condition do you think the atria is not going to contract? So, there are conditions called as atrial fibrillation. In your like second year, you will understand, like in even first year also it will come. Arrhythmias, sir, arrhythmias. Atria is not going to contract. Normally atria should contract. If atria is not contracting, just quivering like this, just shivering, sir. Right. The exact word is quivering, but atria is just shaking like this. Okay, that's called as atrial fibrillation. Okay, so in the condition called as atrial fibrillation, the atria is not going to contract, atrial asystole is seen. When atria is not contracting, A waves are not seen. Simple, simple. Second condition, देखो. The second condition is large A waves. Okay, so large A waves. First of all, A wave is what? A wave is a positive wave, means the pressure in the internal jugular vein is increasing. Why A waves? Because of the atrial contraction. Now large A wave, for example, A wave is going to be large, like this. A waves, large A wave. It is seen in which conditions? Large A waves are seen in tricuspid stenosis. Okay, tricuspid stenosis. What is this tricuspid stenosis? You know it, sir. This is right atria. Here it is right ventricle, right atria, right ventricle. Now, this is which wall? This is the tricuspid wall. Tricuspid wall. The tricuspid wall, it is now stenosed. Now the tricuspid valve is stenosed. When the tricuspid valve is stenosed, now tell me, in order to pump the blood down, in order to push the blood down into the right ventricle, now right atria have to generate more pressure or less pressure? Right atria have to generate more pressure. More pressure, right atria have to generate more pressure. So right atrial pressure increases, internal jugular vein pressure increases. The exact concept here is, whenever there is a tricuspid stenosis, so the blood is not going to go into the right ventricle properly. All the blood is not going to properly empty into the right ventricle. So here the pressure increases, sir. Okay, already in the right atria, some amount of blood is going to left over. It is not properly receiving the. See, the problem is the outflow tract obstruction. There is an obstruction in the outflow down into the ventricle. So it is not going to properly receive the blood, sir. Right atria. Okay, because the outflow is obstructed. So now the blood from the internal jugular vein, it will properly not going to drain into the right atria. Why? Because already in the right atria some blood is left over. Because of this stenosis, tricuspid stenosis, there is a block. As there is a block, do you think proper flow will happen? No. So proper flow from internal jugular vein is going to happen? No. Why? Because there is a block here. Okay. Now little by little blood is coming down into the right ventricle. So here more blood is getting accumulated in the right atria. Here also more blood will accumulate. So that increases the internal jugular venous pressure. So in this condition called as a tricuspid stenosis, you are going to have large A waves. Large A waves are seen. Okay. Next, third condition, which is called as cannon A waves. Okay, cannon A waves, sir. Cannon A waves. See, the whole point is, if you know the normal, okay, this is normal, first year physiology. They will also ask you what are the abnormals, in which conditions large A waves are seen, in which conditions A waves are absent, in which conditions cannon A waves are seen. Okay, cannon A waves are seen. Now, normally guys, you should understand something. First atria will contract, fills the blood into the ventricles, then ventricles will contract. First atria will contract, and when the atria are relaxing, then ventricles will contract. Okay, then the right ventricle will contract. Right atria contracts, then right ventricle will contract. Don't think that both atria and ventricle are contracting at the same time. No, first atria contracts, later ventricle contracts. First atria, later ventricle. Now, what happens? There are certain conditions, sir, which are called as AV blocks. Which are called as AV blocks. For example, third degree heart block. So during this third degree heart block, do you know what happens? There will be AV dissociation. Now you will get it out, sir. What is AV dissociation, sir? We haven't heard about this anywhere. AV dissociation means the atrioventricular dissociation. Atrioventricular dissociation, which means, now look here. So this is the right atria, this is the right ventricle. Both are contracting at the same time. Both are contracting at the same time. Both atria and ventricle both are contracting at the same time. Here, what is this valve which is present over here? The tricuspid valve. It is closed state. Now, right atrium, it is contracting while the tricuspid valve is closed. Normally, what it should be? It should be like right atria. When the right atria is contracting, okay, when the right atria it is contracting, the tricuspid valve should be in open state. Then only, no, the 30% of the blood will come into the right ventricle. But now what is happening? Because of this condition called as the third degree heart block, there will be atrioventricular dissociation, which means the atria is contracting on its own, ventricle is contracting on its own, with a closed tricuspid valve. The tricuspid valve is closed. So what happened to the pressure here, sir? Increases so much because the blood is not coming down, sir. The blood is not going down into the ventricle. The ventricle, right atria is already having lot of blood. The blood is not going out. So now, will the blood which is present in the internal jugular vein, do you think it will going to drain properly, flow properly into the right atria? No, it's not going to flow. Okay, it's not going to flow, sir. Understood? So, in a condition called as third degree heart block or AV dissociation, you are going to have cannon A waves, means the A waves are going to be like this. Of course, they are also looking like a all, but this kind of pattern of A waves, okay, I will show you. Look here. See here. See, these are the large A waves. Okay, A wave is large like this. Large A waves are seen in tricuspid stenosis. I have explained you. And cannon A waves, dekho, cannon A waves. No one will ask you about the graph. Okay, no one will show you the graph, sir. They will ask large A waves are seen in tricuspid stenosis. Cannon A waves are seen in AV dissociation. Okay, complete heart block or third degree heart block. Okay, there is AV dissociation. Why? Because the right atrium is contracting while the tricuspid valve is closed. Now, absent A waves. Okay, absent A waves. Absent A waves are seen in which condition? Atrial fibrillation. Like that, many. So, many will come, sir. Okay, many will come. So, that you will study in your subsequent, like, the classes. Okay. So, the basic things, two things I have explained you today. The left ventricular pressure volume loops, how to understand it and how, how it will change in like abnormalities like aortic stenosis. And the second abnormality that I have discussed here is this one. What is this? The jugular venous pressures. Okay, the jugular venous pressures. So, how the jugular venous pressures are going to change. Okay, what are the different waves which are seen. Okay, guys, with this our topics are completed. Hope the class is helpful for you today. Okay. So with this, the two topics, left ventricular pressure volume loops and its abnormalities, and the jugular venous pressures are completed, sir. Hope the class is helpful. See you soon. Thank you.